small presentation on engineering stepping up the challenge of coronavirus and other global threats. The World Federation of Engineering Organizations has followed the development in the global spread of COVID-19 with deep concern for both affected and those in the front line of response. What began as a cluster of infection in Wuhan, China, has now spread to more than 70 countries, causing thousands of new cases and fatalities, as well as wide-scale disruption and fear, both societally and economically. The outbreak of this novel coronavirus has demonstrated the globalized nature of the new and evolving challenges that humankind is facing, while also revealing the necessity and importance of international cooperation in confronting them. COVID-19, like other existential threats, such as climate change, water shortages, food insecurity, not only affects people, but it also impacts trade, travel, education, and labor across borders. I'm sure a lot of us here had one reason to travel or the other, but for this, one has to cancel or reschedule that program. As the world's problem solvers, engineers worldwide are striving to rise to these challenges with increasingly innovative solutions, aided by advances in technology to provide short-term and long-term responses. On infrastructure, the outbreak of the novel coronavirus raised the urgent need for special infrastructure to help quarantine, treat, and contain cases of the illness. Building two specialty 1,000-bed hospital and 1,600-bed hospitals within a span of 10 days is certainly a very big engineering contribution. It is also a reminder of the importance of collaboration between different engineering professions to meet such a high specification with specialized ventilation and water treatment systems, quarantine wards, and reliable power supply, as well as high-speed internet. To be precise, during construction for the 160-bed hospital, about 17,000 personnel were deployed for that construction. 17,000 personnel of different trade and skills. The response to the outbreak also reinforces the importance of maintaining a skilled and experienced workforce. In many countries, there is a shortage of both engineering talents and opportunities for professional development, as heightened in this year's Global Engineer Survey. Investing in and upskilling engineers is critical to drive economic growth and to provide an insurance against shocks and crises. Faced with the ongoing pandemic, WFU called on engineers worldwide to take rapid action and make emergency plans based on local conditions to address the urgent infrastructure needs and control coronavirus. On medicine, engineers can also provide tools to help clinical treatment. For example, scientists and engineers have developed algorithms to help predict the biomolecular structure of COVID-19, an important step in the process of developing an effective vaccine for the virus. In addition, different kinds of tools using artificial intelligence and computer vision for the quick screening and diagnosis of patients are being tested. In the meantime, medicines, food, and care for affected patients have been delivered by healthcare professionals safely, thanks to effective personal protection equipment and clothing, which are all a product of engineering work. And robots are also being deployed to bring further support, helping protect the medical workers and also to limit the spread of the disease. Bioengineering offers significant opportunities to develop new healthcare innovations by blending two traditional disciplines and using the ingenuity of engineers to improve medicine. This will be further enhanced by recruiting a diverse range of problem solvers. WFU therefore calls on national governments an engineering organization to bring engineers, scientists, and doctors together in medical plus engineering projects to explore the enormous potential of engineering in helping medical treatment more efficiently and safely. With regards to monitoring, an important aspect of the response to the coronavirus outbreak has been to monitor its spread, in which computer engineers have played an important role by developing digital platforms to collect accurate and up-to-date data. Analyzing them with proper models, sometimes using machine learning, allows governments and agencies to give reliable advice to the public and get relevant decisions about disease control and management. WHO call on engineers of different professions to continue to find ways to harness the power of data technology. When using big data techniques to improve engineering practice, engineers are also responsible for ensuring engineering data is recorded, stored, and disseminated in time and with integrity. Artificial intelligence, machine learning, and satellite technology all offer new tools with which to tackle global challenges. Moreover, encouraging and inspiring the next generation of engineers will be vital when it comes to making the most of these innovations. Collaboration and partnership. Collaboration and partnership are key for engineers to carry out works to fight coronavirus and other global threats most effectively. WHO calls on engineers to cooperate actively with colleagues of different engineering professions, as well as doctors, social workers, teachers, government officers, and the private sector. WHO also calls on national governments, the United Nations, and other international organizations to take effective measures to facilitate international engineering cooperation, to enhance engineering capacity nationally and globally, to address pressing challenges in short and long term. Furthermore, we call on engineers to share engineering developments and experiences, including data, algorithms, and new technology in an open source model to increase their value and potential application in solving problems in every country of the world, thus leaving no one behind. Engineering for sustainable development. COVID-19 is one of the many global threats facing the world today, and engineers are at the forefront of developing the new technologies, infrastructure, and solutions that will help us respond. In the decade of delivery before the UN 2030 target for sustainable development, engineering has a vital role in every aspect of clean water and energy to health, well-being, and gender equality. Higher education institutes, national governments, and international bodies must prioritize long-term engineering capability building to respond to current threats and future-proof economies and societies against new challenges. WHO will continue to accelerate the implementation of the Sustainable Development Goals to lead the engineering profession in building fairer, safer, and more sustainable world. Distinguished ladies and gentlemen, I thank you very much for listening.